Hi, everyone. We're at the top of the hour, and welcome to the AUR webinar series for educators. This section will cover publishing and reviewing from an editor's perspective, and I wanted to acknowledge a lot of the framing and the thought material for this conversation originated with Bruce Hillman, so I wanted to give him a shout out. So for those of you who are joining us, let's structure this as a conversation, and if you have any comments or questions as we go along, please enter them in the chat box to the right of your screen. This is a bit of a reversal. Normally, this is where the speaker would present objectives for the talk, but what I would like to do is I would like to understand what your objectives are for this talk. Would you like to learn how to be a better writer, a better editor, a better reviewer, or if you have other goals entirely? And that would help us, me in particular, better structure the conversation to meet your needs. So use the chat box to the right, follow the blue arrow, and enter what your current objectives are, and we'll go from there. So feel free to enter them whenever you're ready. This is from a blog post written by a sociologist entitled, "Is Peer Review Bad for Your Mental Health?" We've heard quite a bit about physician burnout in the clinical realm. There's also emerging literature in burnout among academics due to a variety of pressures related to teaching load, declining grant support to continue intellectual and discovery activities, the inflation of promotion requirements, including the number of publications, and the overall uncertainty, not just with the promotion process, but even on the publication submission and review process. Oftentimes you send your paper into the void, you have no communication until you receive the editorial result, and perhaps part of what is weighing on scientists is the inherent uncertainty in much of the work that they do. So the goal of this talk is to demystify to some extent what editors look for and what reviewers look for when we look at a submission, a manuscript submission. The key is that we want it to be relevant, valid, reproducible, and generalizable, and we will go through each of these criteria. Relevant. The research should address an important real-life issue that confronts your practice, place of employment, or society. In an educational setting, this would mean the teaching environment, the tools, and the audience that you evaluate are all relevant to your practice. So when one structures the introduction, you would like to include the following elements. What was studied? What was the perspective that you took, institutional, peer, societal, teaching environment, the learner perspective, or the teacher perspective? Why is the research important? Does the topic under study affect a lot of people? Or will the technology have a large impact or effect on patients or patient outcomes, even if it affects only a few patients? Is there a well-designed, well-defined research aim or hypothesis? And this is really key, ensuring that there is a well-defined research aim or hypothesis, because all of the components after the research aim or hypothesis flow directly from the statement, which is a statement of essentially what you are studying. And reviewers and editors pay a lot of attention to what you say you're going to study and whether you actually studied what you studied and whether the results reflect what you say you studied. Are the methods reasonable, defensible, and ideally comparable to those used in previous research? So you would want to use established methods. It should involve appropriate disciplines. So in an educational environment, you would want to involve those who understand educational pedagogy, those who are experts in the educational technology that you're using, those who are experts in the learner population that you are studying. It should ideally be free of key biases, and we'll come back to the concept of bias. And if your technique or protocol deviates from other research, you would want to provide a rationale. For example, how are previous methodologies limited or flawed, and how is your new method correcting for that flaw or that limitation? The study should be reproducible. A new study seeking to replicate the one that you have proposed should produce reasonable results, accounting for minor differences in perhaps patient population. One of the ways to also be able to demonstrate that you have included the appropriate number of individuals or appropriate population size is to do a pre-study sample calculation to demonstrate what the hypothesized effect size is. So for example, if you're comparing two teaching tools and you think that memory retention using tool A will improve memory retention at 20%, compared to tool B, you can explicitly calculate the number of individuals or learners that you would need to expose to tool A versus tool B in order to guarantee that you will have studied the appropriate number of individuals. You also want to pay attention to study accrual. Who actually participates in your study? It is unrealistic to expect that all patients or all learners who you approach to participate in the study will be able to participate. However, if the participation rate is very low, then that calls into question the reproducibility and generalizability of your results. Clinical trials are now moving toward measuring the demographic characteristics of those who do not participate in the study in order to show that that population is in key variables similar to the population that participated in the clinical trial itself. As there are existing data that show that individuals who participate in clinical trials overall tend to have insurance, they tend to have higher economic means, they tend to be more educated, and they tend to be more white, fewer race and ethnic minorities. So really understanding who declines to participate is part of understanding the effect of your intervention. And then if one is doing a reader study or identifying or evaluating a new technology, such as a teaching technology, you would need to understand what the intra and inter-rater reliability is of the tool. Does the tool perform similarly in the same individual if used at two different times? And does it perform the same across different individuals? The results should be representative of some identifiable segment of the real world. It has to be generalizable to a population beyond the population that you studied. And things that a reviewer or an editor might be looking for are, was the research conducted in a single institution or multiple institutions? How well do the authors describe the samples? For example, how well is the technology, the patients, the radiologist, or the readers described? How well are the teachers, learners, and tools described? For example, teaching expertise or length of teaching, the demographic characteristics of learners, including stage of learning, and the tools themselves, including how the tools were developed, initially pilot tested, and how it was rolled out in this particular study. Were institutions and patients like yours involved? And this gets into spectrum of participants. Many studies, particularly those in the early phase of technology development, tend to evaluate individuals who have more disease. And you can expect that technology would tend to detect disease better, faster, if there was more disease to detect. So presenting a spectrum of patients or or exposing a spectrum of patients from those with very little disease to those with a lot of disease and those without the disease is important. And in a learning setting, the spectrum would refer to the spectrum of learners, including those most advanced to least advanced, and teaching environments, and that can range from an academic teaching center with a large resident population to a hybrid program that has primarily community practice and a residency program, and the different permutations in between. So we're back to bias, and a key thing to remember is that nearly all research contains some bias, because the research is just an approximation of the real world. And the key to understanding bias is understanding that everything about bias is a trade-off between sample size, time, and cost. So you want to have the largest possible sample size in order to make it as reproducible as possible across the largest population. However, the bigger the sample size, the more time it takes, the more costly it is. And as with many things that we do in clinical practice, we have to decide at what point we are willing to trade off research certainty or certainty of the study design with practicalities like sample size, time, and cost. As you write up your results as authors, you should then be able to recognize biases in your own research and include a detailed limitation section that shows that you recognize what biases you accepted and what the potential impact of those biases are on the results. Did the bias make the test look better or worse? Did the bias overestimate or underestimate its generalizability into a population? Did you estimate the floor, meaning the real effect is actually higher, or did you estimate the ceiling, meaning the real effect is actually lower? And the interpretation of those biases would then depend on what your underlying aim was. The readers and reviewers must then decide whether the outcomes themselves are related to what you actually studied, the intervention, or whether they're dictated by the biases themselves. Did the result come from the fact that your study was structured in a way that accounted for the biases as best as possible, or were actually driven by the biases inherent in the study? And the results are not necessarily wrong. In any individual study, the results are not necessarily wrong, but we don't necessarily know that they are right. So because we know that there are many biases in almost all study designs, let's go through what some of the potential biases are in a randomized controlled trial. What are some of the key biases in a randomized controlled trial? And go ahead and use your chat box to answer this one if you'd like. One of the key biases to a randomized controlled trial is that it's often difficult to generalize to a larger population because we are testing efficacy. We are testing an intervention in the best possible environment, using the best possible tools, where we optimize our protocol to decrease patient loss to follow-up or patient dropout. In reality, that's not how clinical work functions. And work is now evolving toward more pragmatic trials where we allow sites that participate to determine how they can implement the particular intervention that's being tested within their own clinical practice. So the bias in a pragmatic trial is that we don't quite know what the active ingredient is that is causing the outcome. So for example, if we have a patient-shared decision-making tool in a randomized controlled trial, we would dictate what is discussed in the tool, when the tool was given, when the outcomes were collected. In a pragmatic trial, we might provide the tool but then allow the sites to determine when to give that tool, whether they would give it at the patient enrollment, when the patient got tested, or when the patient saw their surgeon, or at some point after when the patient saw the surgeon, based on their workflow and how that tool would be used in practice in that kind of environment. So what it actually does is it allows us to mimic the real world, but then it becomes difficult to say that it becomes difficult to pinpoint what exactly about the entire process contained the active ingredient. And finally, many of us, most of us, and many of the trials out there tend to conduct observational trials due to sample size, cost, and time limitations. And these observational trials, for the most part, are demonstrate associations, and causality is difficult to show. And that would be the primary bias in an observational trial. All of these trial designs are appropriate for a wide variety of interventions, including educational interventions, as long as you understand what the relative trade-offs are for each of these trials and be able to articulate what these limitations are based on the trial design. So after you've described your methodology completely, then you move to the results, and you need to report on all the things that you said in the methods you were going to study, and you don't provide results for which you didn't provide a methodology for defining and collecting those results. It also explains how any subjects were excluded from the analysis. Why were this group not analyzed? Why did you exclude outliers, etc.? And most importantly, if you're, say, conducting a survey study over time, oftentimes not all questions in any given survey would be answered, and not all surveys are answered over time across the whole population. Then it becomes critical to understand how missing data were handled. Well, why is it important? Why can't we just ignore all the data that weren't submitted since we don't have it? Well, sometimes data are systematically missing for a particular reason. For example, the question itself is difficult to understand, or a particular population does not understand that question, can't translate the question, or don't apply to a particular population. So being able to understand why the data were missing and how you're going to handle that is a critical component, particularly for large-scale studies that are meant to be generalizable across large-scale populations. It also provides the results of statistical testing and measures of reproducibility. The key here then from an editorial and reviewer perspective is that you want to avoid redundancy between the text and the figures and tables, but you also don't want to provide too many tables that the reviewer gets lost in all the pictures. And again, the key to results is to avoid opinion and commentary, sticking just to the data, and save interpretation for the discussion. In the discussion, that first paragraph should begin with a brief summary of the key findings, things that you would want the reviewer to understand. It contextualizes previous research. What this means is that you look at what's been done before, and then you put your findings in the context of this other research. Did it agree? Did it disagree? If it disagreed, why do you think it disagreed? Was it because you were measuring something entirely different? Was it because you were measuring it with a better tool? Or was it because things are changing over time? If it disagrees, you would like to explain the differences of the results, of your results compared to the previous research. And here it is important to disclose the biases and limitations, and as I've mentioned before, estimate the impact on the results. In which direction did the biases limit the results that you measured? And then it concludes with 2 or 3 statements on the importance of the finding and the implications for future research and practice, again providing a context for the results that you found. It's not sufficient to say this is what we found. It is better to say this is what we found and this is how we believe it will impact clinical practice, resident teaching or raise additional questions that can be studied through future work. So this is one of my favorite Twitter feeds, and it starts, this one says that the road to publication is paved with rejection at better journals, and there are no wrong papers, there are no unpublishable papers, you just haven't found the right journal yet. So how does one find the right journal? Ideally, you would want to match the content and style to the journal or journals that you are going to submit to. And ideally, as you're writing the paper, you are generating a list of 3 to 4 journals that you would want to target in succession, starting from highest stretch journal to the lowest safe journal, just like applying to medical school or applying to residency, and target your writing style and content for those journals. And be sure to target the appropriate readership. If it's an education paper and you're sending it to a health services research journal, there is an inherent mismatch. Select the journal of appropriate level to match the rigor of the research and the quality of the research versus the rigor of the journal and the quality of the journal. This is a tool that I have used before called Jane, Journal Author Name Estimator, jane.biosemantics.org. And in that box, you can enter your title or some keywords, and it will yield a list of journals where those keywords, titles, or concepts have appeared, including their impact factor. And it streamlines some of the selection process, especially if it's an area that is outside radiology or perhaps outside your area of expertise that you would like to share with a broader audience. So before you send it in, really it's all about following instructions. And every journal has a page or 2 on instructions for authors. Select the correct article type. Is this an original research article? Is it a brief commentary, a letter to the editor? Edit, proofread, and correct grammatical and typographical errors, because these are the easiest to correct and potentially some of the most frustrating to reviewers. Cite references appropriately and use your figures and tables judiciously. Don't overwhelm the reviewers. Provide enough to convey your key findings and no more. So this is how I tend to view the process of research, writing, and review, both as an author and as a reviewer. First, you start out as a chrysalis, and your manuscript emerges as a beautiful butterfly only to be squashed by reviewers. And you thought in your manuscript you were describing how to build a car, but in fact, after peer review and revision, you have built something else entirely that only has passing resemblance to what a car actually is. I would urge you to think of reviews as a learning opportunity. Again, contextualize the editorial decision. Many things drive an editorial decision, not just the reviews, although the reviews form the bulk of the editorial decision. Editors are looking for material that fits with the journal focus, also advancing particular editorial agendas. They may have published something on exactly the same thing very recently and know that something will be coming in very soon that they had just accepted, and for that reason they may not choose to publish this one as a potential Me Too type of publication. So there are a variety of reasons as to why an editor makes a decision that he or she makes. Now the key, if you receive a revise and resubmit, is to respond to the reviewer comments completely and concisely. We disagree with reviewers all the time. The key is to respond rationally, courteously, and in detail as to why you disagree. Provide your responses using track changes so that the reviewer or the editor can quickly see where these changes were made and then clean copies which are meant to go to the publisher. And also bear in mind, peer reviewers have feelings. So as an editor, I remind my reviewers to be kind, to be honest but kind, and I would like to remind authors that peer reviewers are doing a service to the field, and they are genuinely doing their best. So this is a list of what the peer reviewers say, tongue-in-cheek, but what the reviewers say, what the authors hear, what I've heard as an author, and what the reviewers have meant. And many of you who write or read reference letters or letters of recommendation understand that there is often phraseology that goes along with a letter of recommendation, and you will work at interpreting what that letter of recommendation is, just like you will work at interpreting what the reviewers recommend you do. And these are some of the phrases that I have used and what they may have meant. Also from @AcademicsSay, these are potentially 3 reviews for any given New Year's resolution. Reviewer 1 might love it and say it's an ambitious attempt warranting greater situation in the extant self-regulation literature, whereas reviewer 3 might say, I wrote these same resolutions 3 years ago, see below for citation, and reviewer 2 might disagree entirely and say these are not the resolutions I would have written, and I have received all of these comments often in the same submission. So if we are to take a religious view of publication ethics, some of the sins of the authors are authorship, including too many authors or insufficiently acknowledging authorship for those who have materially contributed. Failure of conflict of interest disclosure, duplicate submission or publication, which is really problematic for the field, salami publishing, which has always been with us, but it has now almost reached a fever pitch, and of course plagiarism, which is the most egregious. Sins of the reviewer. Reviewers who review may not let the editor know that this is not part of their content expertise. They may not provide a sufficient depth of review, or they may provide an overly detailed review that doesn't necessarily help the author. They may have an undeclared conflict of interest, including potentially having reviewed the article or the manuscript for a different journal, and not stating that potential conflict. And that in and of itself is not necessarily a conflict as long as the editor is aware and that the reviewer can provide a second review, keeping the journal in mind, keeping the new journal submission in mind. And then there is the inappropriate citation recommendation. The sentence below is the sum total of a review that I had received recently from a reviewer. This paper is a wonderful contribution to the literature. Please cite the following and named 4 of this person's publications. So this is not an ethical review. So for those of you who are Star Wars fans, you may feel like you are Luke Skywalker on the left. When you submit the manuscript, you wait so long, you finally age through all parts of the Star Wars saga when you finally get your manuscript accepted. And of course, publishers have their own sins, and one of the biggest is the business of predatory journals, open access journals that publish for pay. And what is interesting about these predatory journals is that they actually fit a role in the publication ecology. with researchers specifically submitting to predatory journals to publish articles in order to build resumes. And part of this, as I've alluded to earlier, is driven by inflation of qualifications required for new positions or for promotion and tenure. So it is problematic. Okay. And I will end with one more tweet from @AcademicSay to grant me the serenity to accept what I must courage to not change what the editor can accept, and the wisdom to capitalize editor in my reply. So thank you, and if you have questions, please enter them in the chat box. Okay, so hearing none or seeing none, thank you for joining me for this session. Our next speaker will be Aine Kelly.
Good afternoon, everybody. My name is Aine Marie Kelly, and I'm going to follow on from Dr. Carlos by talking about reviewing and publishing educational literature. A little bit about myself. I'm a clinical radiologist and also board-certified physician in internal medicine for my sins. I graduated from Trinity College in Dublin. I've completed a master's degree in clinical research design and statistical analysis, so I'm fortunate to be able to do my own statistics. I also have a master's in higher education with a focus on medical education, and I am currently deputy editor in the area of education for academic radiology, although for only 4 more days Dr. Dunnick is relieving me of my duties. So without further ado, I have a couple of disclosures. I am one of the recipients of the AUR Research and Education Venture Fund grant in 2017, of which this seminar is the result, and I thank the AUR for that honour. I'm also the editor of a Springer book which is entitled Evidence-Based Emergency Imaging, but I will not be discussing this during the presentation. So on to the presentation. So the learning objectives for this talk are to look at the main subject areas for educational research, to become familiar with the outcomes in educational research. We will look at different formats of educational studies and at all times apply critical appraisal skills to our research and review activities. So why should we review? It's the right thing to do. It helps us to keep up to date with the latest evidence. It's part of lifelong learning, which is a regulatory requirement, but it also helps us build a good foundation for our own research efforts. And at the end of the day, it does help you become a more successful publisher. Journals are always looking for reviewers, so please consider volunteering. So let's turn and look at focus of educational research. Educational research is centered on learning and teaching, and also largely on curricula. Learning can describe the setting in which learning is taking place. It can describe the process of learning, and it can describe how you assess or evaluate the effects of the learning, whether that be a subjective thing like satisfaction with, or a more objective measure. Educational research can look at teaching methodologies, including technology, such as use of simulators. It can describe their development and implementation and evaluation. Curricula are a large area of educational research focus, including the design, and I'll talk a little later about curriculum development, but also looking at implementation of curricula evaluation. So authors have looked at the focus of educational research to date, and this pie chart shows the breakdown. In blue was the focus on trainees, whether they be medical students, residents, or others. And to a lesser extent, the red area here shows the study of faculty or colleagues, such as CME courses. There are less publications on other providers and fewer publications on educational studies with patients as the subjects. The same authors looked at the outcomes that were studied in educational research, and these largely focused on performance of trainees with metrics such as exam scores, clinical skills, bedside manner, or compliance. Other measurements include satisfaction, which could be opinions, perceptions, feelings, beliefs, and attitudes. Other areas to look at include professionalism aspects such as career choices and outcomes, and costs. Sorry, my system is frozen. I'm just going to try and, there we go. So there are many types of educational research projects, many flavors. These would include descriptive reports, and a lot of educational studies currently are descriptive. These also include reports of committees. These are consensus conference proceedings, which would use a iterative Delphi type process to derive some recommendations. These also include primary and secondary studies. And primary studies include the analytical trials, cross-sectional studies such as surveys, or a mixture of both of those. And secondary studies, as in the non-educational literature, include systematic reviews, meta-analyses, guidelines from experts, decision and economic analyses. Here's an example of a consensus proceeding in the area of radiology education. It's from 2001 in the journal Radiology. But you can see here listed many radiologists, so this was an expert consensus panel. No talk on education would be complete without talking about curricular innovations. And in education, there's a very established, validated approach, which is the Kern approach, and this is from the textbook here on the right. But it has 6 steps in the process, the first of which is identifying the problem by doing a general needs assessment. So that could be something like developing a curriculum for radiology residents. We would then do a more targeted needs assessment of our learners. So that might be radiology residents who are doing cardiothoracic radiology. We would then outline educational goals and objectives, which might be training them to be good radiologists in the future, but also equipping them to pass their examinations. We would then devise instructional strategies, whether that be workshops or lectures or case-based methods. We would then implement our educational intervention, deciding who is going to deliver it, where it's going to be delivered, and when. And then following intervention, we would evaluate the results of our process, either by surveys or by more objective measures. So you will see this Kern process, but it's important if you come across studies that discuss curricular development that they employ these steps. Educational research studies have a hierarchy as in non-educational research, and these range like the totem pole, starting with experimental studies such as randomized controlled trials or prospective cohort studies. In education, some of the terminology is different, such as prospective controlled experiment. And then as we go down the totem pole, we have quasi-experimental, which would include observational cohort studies, and then pre-experimental, which would include case-controlled trials. And then finally, we have descriptive studies, such as a new teaching methodology, such as flipping a classroom or a new technology in the classroom. So I'm just going to outline 1 or 2 examples of educational study designs. I've covered this in more detail on an earlier webinar from this series. So randomized controlled trials would involve, in theory, splitting a class into 2 random groups. I have to add at this point that in practice that's very hard to do. It's very hard to have students blinded as to whether they're getting the intervention or the alternative, and often it's not ethical in education. But in theory, we could pre-test the students, deliver the intervention and the control educational method, and then test the students afterwards. If we didn't randomize, we call this a comparison group, and it's analogous to the cohort study. I want to mention briefly the Solomon 4 group design, because this is relatively unique to education, And what happens with educational studies is, if we have a pretest, the taking of the pretest can influence the performance on the post-test. So sometimes it's hard to separate out the effect of doing the pretest on the post-test performance. So in the Solomon 4-group design, we randomize initially at a level, eliminating the pretest on one side, and then within that group we also split or randomize the subjects as well to receive the intervention or the control. So the object of the Solomon 4-group design is to flush out the effects of doing the pretesting on the post-test performance. Turning to quasi-experimental study designs, the terminology, as I said, is different. A controlled study outside of education is called a non-equivalent control group study. And they're non-equivalent because it's not always possible to correct for all confounders or factors that might affect the outcome. And I've shown here the pre- and post-test format, but sometimes this will just be a post-test, depending on the conditions that you have. I'm going to show you counterbalanced and time series designs, because these are relatively unusual outside of the educational focus. Counterbalanced, we see similar trials in pharmacology where people would be tested with drug A and then drug B, but the educational equivalent is where people receive educational intervention A or B, and then they're tested and then they receive the other intervention. So that's the counterbalanced design. A time series design involves a group who are tested and receive multiple interventions. An example in radiology might be a group of radiology residents at a single program who receive lectures preparing them for on-call duties and are assessed after delivery of the lectures over and over again to see the incremental benefit of the lectures or the educational intervention. And then there's the pre-experimental designs, and these have terminologies including the one group pre- and post-test, or the one-shot case study design. And this is where you have a single group who undergoes an intervention and has a pre- and post-test or just the post-test. There's also a static group comparison design, which is two separate samples who get a post-test only. This is the static group. And this might be two groups who are in different programs or even a different institution who may not have a lot of similarities. It's hard to control for confounding variables. And one group would have the new intervention, maybe a new teaching technology, and the other would have conventional teaching, and then they're tested after that. So to date, there isn't a very well-established guideline document for reviewing of educational papers, but there is an excellent publication by Georges Bordage et al., which was in Academic Medicine 2001. This now requires a fee to access, but I found a workaround, which is on the AAMC website. They have an excellent PDF, which is free, and it summarizes Dr. Bordage's papers and has some very user-friendly tables. So this is an excellent review guideline. If you are reviewing or publishing or carrying out an educational research project, I highly recommend this. So I'm going to turn to a few aspects of reviewing. Dr. Carlos has covered a lot of these already in her presentation. The main sections of the paper to review are title, abstract, introduction, methods, results, discussion, limitations, and conclusions. However, if you're like me and you review a lot of papers, reviewers are busy, so they might skim and look quickly. So a busy reviewer will often jump quickly to the abstract, and within that they will look at the methods and the results. So it's very important that these sections be strong and stand for themselves in the paper. Abstracts in educational literature don't necessarily conform to the usual 4 to 7 sections of objectives, methods, results, or discussion. If it's a description, the abstract will not conform. It'll just be a short summary of the paper. Objectives for the study should be clear and relatively specific. Depending on the journal, most of these should conform to a 250-word limit. And as I said, for a busy reviewer or somebody who's doing a literature search and is trawling through thousands of papers, the abstract should be standalone. Without reading the rest of the paper, it should convey the message. So the introduction is the who cares factor. Is this study important? It sets the scene for the rest of the paper. Has it been done before? Perhaps it's been done differently, or perhaps we're using a more advanced technology. It should have a good literature search as its foundation, and the authors need to make a good case for performing the study. Typically, there'll be 2 or 3 paragraphs, 1 introducing the problem, 2 is the context or motivation to perform this study, and often the 3rd paragraph, the last sentence says, because of this, we are deciding to, and then they will outline in 1 sentence what the purpose of the study is. Institutional review board or ethics board approval is necessary, and this will often be at the start of the methods or materials section, and this is very important. I should mention that in education studies, students often become the participants, particularly if you're tracking data. For example, if you were pre-testing and post-testing students and delivering an intervention such as the ACR appropriateness criteria, guideline and cases, you might want to track individual students' performance and improvement, so they would have to be protected by ethics board or IRB approval. So best to check with your IRB. Better safe rather than sorry, as they say. So materials and methods should be logically laid out a bit like the surgeon's table here, with subheadings, starting with the learner population, who they are, also describing the education intervention, what definitions, criteria, measures, cutoffs were used, how the data is collected and validated, and also statistical analysis, if that's applicable. Study subjects should be described. How were they recruited? Was it a convenience sample? Were they solicited? Could there have been recruitment bias based on the method of recruitment? What is the setting? Is it real-life circumstances or more like a educational workshop or laboratory setting? Inclusion and exclusion criteria should be explicitly stated. The more rigorous they are, the more specific will be the study, and it will be less generalizable. So it's a bit of a trade-off. Were the study subjects, the students, blinded or masked? And as I said earlier, that's difficult to achieve in educational studies. So systematic or systemic bias could be introduced. In educational studies, sample sizes are often quite small, and reviewers accept that. It's probably best if you have a small sample size to say this is a pilot study. Study design methods section should be laid out like a recipe in a cookbook. Firstly, it should be appropriate to answer the question that's asked or solve the problem that exists. It should be laid out such that you could go home and reproduce what they did, like a recipe. So it should be clear and detailed. Validity of the study is making the correct inferences regarding the study findings. It's the credibility of the study. Validity can be threatened by internal factors such as confounders and biases, or external factors such as generalizability. In education, the outcomes that we look at are often downstream from the intervention. We educate medical students, but the outcome, the level of patient care that patients receive, often occurs downstream, and there are many confounding or interactive variables. And this is a challenge that we have and accept in education. And also the outcomes can be more objective or subjective in education as well. Data collection should use an appropriate, validated measurement device. If there isn't one out there and they develop their own method, it's important that the authors justify the development of that and the selection of it. Again, they should use appropriate cutoffs, thresholds that are valid, reliable, reproducible, sensitive, and specific. Dr. Carlos has mentioned a couple of these, but I'll just run through them. Validity can be threatened by multiple biases, which can include unmasking. In education, did they try and compare the established method with the new method? Did they try to avoid treating the groups differently or systematic bias? Was the educational intervention evaluated in a real-life setting? And was it validated or used in a second independent group of learners? This is a very good option if you have a small population or class size to actually make your study or your intervention at multiple institutions to boost the numbers. Statistical analysis, I showed the empty classroom because all too often there is none. And that may be appropriate, but sometimes even when it is necessary, it's often absent. I'm going to talk about statistics in a few moments. Within the results, they should use subheadings again, including study population, comparison of groups within that population, the results and the outcomes, and also any measures of validity. Statistical analysis should be described, and this should be supported with tables, graphs, and figures. And as Dr. Carlos talked about this earlier, it's important not to duplicate too much. Sometimes it can be better said in a table rather than text, so not to duplicate. Results should be laid out clearly and logically with significant findings first, and the flow of the results section should parallel the introduction and methods. It's important to address any flaws in the study design, and in this section the author should not try to interpret the results. That belongs in the discussion, and they should use appropriate numbers of figures, graphs, and charts. Statistical strength, I know this is a busy slide, should be assessed, and for most reviewers and authors, this may be outside of their area of expertise, so it's important to employ a biostatistician. But if you're reviewing for a journal, journal editors often have access to biostatistical expertise. But the questions that we would ask include, is statistical analysis needed for this study, and which one is appropriate? And that's determined by looking at the data. Is it continuous numerical data, ordinal data, ranking, or dichotomous yes-no data, or categorical? Is the data parametric? That indicates that it fits a normal curve. And if you're not sure, you can graph the data and see, does it come out like a bell curve? Or is it non-parametric? Are there one, two, or more groups? Is the data independent or dependent, such as a pre-test and a post-test in the same student? They will be dependent. What is the sample size? And this relates to the power of the study to show a difference. Statistical significance, traditionally p-values, but effect sizes are becoming more popular, and these are relatively independent of study size. And also measures of precision should be included, such as standard deviation and confidence intervals. This is a busy slide, but just to say there are lots of excellent resources out there which will pinpoint you to the right test to do, or pinpoint you to guide the authors as well. Discussion section should also be arranged in subsections, starting with a summary of the main results found in the paper. This is where the interpretation of the results takes place, and the authors need to put the results in context of what we know already, and also they need to try and describe the implications for education. How does this change things? Limitations should always be addressed, and at the end of the discussion, the author should summarize and describe what the next steps are. Where do we go from here? What do they recommend? They should have answered the research questions. The order of the discussion should parallel the previous methods and results sections, and the evidence that exists should be adequately discussed, and also alternative possibilities should be entertained for the findings. If there are unexpected findings, the author should try and explain and account for how they happened, or if they're not sure, just try and theorize how it could have happened. At all times, they should compare to existing literature, and try and compare and contrast to explore and justify similarities and differences. Conclusions of the study should justify their interpretations in light of the strengths and limitations of the study. And as I said, authors should give their personal perspective or try and explain things. The practical significance and the future implications should be discussed. Do we need more study in this area, or what recommendations do they make to educators in practice? Disclosures should be mentioned at some point in the paper. They often appear at the end of the paper to include sources of funding and any potential conflicts of interest. I'm just going to end with a summary. Reviewers have evaluated studies that were successful or not successful and listed the main factors in success in this slide. And the main factors underlying successful projects were an important problem that was timely, relevant, and critical, a well-written, logical, easy-to-understand manuscript, a well-designed study with appropriate methodology. And these three factors accounted for most of the reasons for success. Other good factors were adequate review of literature, well-articulated problem, practical implications, good sample size, and accounting for study limitations. On the other hand, when studies were weak or rejected, the causes for this often included inappropriate or lack of statistics, overinterpretation of the results, or using the inappropriate or wrong instrument to measure the outcome, using a small or biased sample, text that was meandering or difficult to follow or understand, and an insufficient or incomplete problem statement. So that brings me to the end. I hope that you have an idea for reviewing and publishing. Just to say that education research is still a developing area, so I see it as a low-hanging fruit. There's lots of growth and opportunity in the areas of publication and research. And I think if you review, it helps you publish. And I think we need to do both of these to advance the field of radiology medical education. So I thank you very much for your time. I'd welcome any questions now. And if you think of questions later, please don't hesitate to drop me an email. But I'd like to open the floor for any questions, comments, concerns. If there are no questions or burning issues, I would like to thank Dr. Carlos and thank Carrie O'Connor and the AUR Research and Education Foundation for supporting this initiative. And I will sign out. Thank you again. And please don't forget to review. All of the talks are on the AUR website as well. Thank you.